I hope now to be able to show with my colleagues Ashok Handa and Virginia Bobrick how we would actually undertake MCR, with me acting as the lead clinical supervisor, and then with my colleagues discussing a trainee. The trainee we've decided to discuss will be at the level of ST6, so this would be their first interim MCR in the ST6 year, which will be the year they're working towards being signed off to take the exam. And we'll highlight some aspects of that training and points for development, which will see them much better placed to be able to take the exam. So that's the focus that we're looking at now. So if we come to follow the MCR, we've decided which placement it is, and we've shown who is taking part, and therefore we will continue. So we go first to the generic professional capabilities, and the first one being the professional values and behaviour. And we do think that there are some areas for development, so we would look at where those stand, the descriptors. And I would counter that managing time and resources effectively is something that this trainee would want to develop, and certainly they want to develop on how they do their revision time effectively, but certainly within the workplace they often find themselves running out of time. I suspect there may be a knowledge factor and experience that comes with that, but I would feel, my experience, that that's something that they could develop. Would you agree?
Yes, I'd agree with that. I can't see any other, unless you just scroll down to the other behaviour. I'd agree with that one. The only other one I might add is the demonstrating situational awareness.
Okay.
Occasionally, which I think does link into the managing time and resources effectively. But other than that, I'm happy.
There's any particular aspect when feeding back? Do you think? I mean, certainly I'd agree with you. Particularly, I think in that sort of multidisciplinary. I'm not sure in the endovascular work yet that there's a full awareness of what's going on.
Or when under significant pressure, I think sometimes just losing sight of everything else around and everyone else within that situation.
Yeah, so particularly in those sort of slightly more stressful situations, maybe with an emergency in the endovascular suite. So there is that little bit around situational awareness.
And but do you think there's anything else that you would add in? These aspects, demonstrating awareness of limitations or behaviour. I mean, I certainly don't. I think they're very aware of their limitations. I've had lots of coffees where discussing, and there's a bit of encouragement sometimes, let's say. But I don't think they ever put people at risk.
No,
certainly I've never seen any patient risk aspects of things.
No, I agree.
Yeah, I would agree. There's no issue around that kind of behaviour, and certainly very good at referring on or seeking advice.
Yes. What about, just as we go, the interacting with colleagues? This is that MDT, working as a collaborative member of the team. When things get a bit stressful, do you think that's something that to have worked on, or do you think that's very much appropriate for phase in relation to that?
Yeah.
I mean, so we're talking ST6. They realistically should be sort of indirect supervision levels now. I'd on being comfortable about that, and I mean so. It might come back. It might come into the discussion as a feedback.
No, I think taken as a level appropriate. I would say that I would be happy with the level they're at now, but that they do need. Hopefully, they will develop that as they advance through their training.
Yeah.
And I think that's right. That I think it's something that, in a way, all of us need to work at all the time. I certainly do. But I think saying that for an ST6, I don't have concerns about that. But in the feedback, that's the sort of thing we all need to work on.
Okay. Well, I think I've got. We've just highlighted 2 aspects. You can go up to 5 in each of these domains, but I don't think it would necessarily. I could see how that I would have a clear idea of how I see that discussion going. I'm happy to discuss, and if there was anything you would raise, but capability in health promotion and illness prevention, I think he's absolutely appropriate for phase. I wouldn't. There's nothing I think I'd expect of any more for him at an ST6 level.
Absolutely, yeah.
We spend most of our clinics telling people to stop smoking and manage their diabetes, and I think he does it very well.
Yeah. And I'd say again about patient safety, quality improvement. I think that he's absolutely in relation to phase, and the same would apply for 7, I think, and 8. I just might wonder, because of what we've been talking about at the MDT, perhaps if we look at the capabilities in leadership and team working, if we look at some of the descriptors, I'm not actually sure that there is an issue, but I wonder about that. Is there any of these you think that fit into how that the issues that we've raised about MDT working?
Well, does promoting and effectively participating in multidisciplinary and interprofessional team working fit that? I think that he does achieve that.
Yeah. I mean, there's certainly aspects in relation to feedback. I don't think there's anything.
No.
Listen, I mean, I think that we could write free text.
Yeah, I think that would be better, because I don't think any of those drop downs actually cover what we're trying to say, because otherwise leadership style is very good.
So in a brief statement in relation to looking to,
I think it's more about awareness of multidisciplinary working when under stressful situations or when pressurized, or,
to be honest, it's more about being able to use your full range of leadership styles. It's much more about that, that sometimes you need to adapt your style to a particular situation or particular group of people. And as you say, Jenny, overall good leadership styles, but not always able to adapt them. I don't know if that's a helpful comment.
I think that encapsulates it. Yeah.
So what I'm hearing you saying is to be able to recognise all opinions and options within the MDT working and utilise leadership style to be able to undertake this.
Yeah.
Great. Okay, so I'm comfortable that with the pattern that's there, and we're happy to move on now.
Yes.
So we go on to the CIPs. That they say obviously these are the general CIPs, and vascular surgery just has those 5 general CIPs. We don't have any specialty additional ones. And for the capability in practice for our curriculum sets the supervision level at ST6 requirement for being 3 for the first 3, and then the last 2 are just at level 2 for finish of 6, because we think that the majority of that development is going to be on. So you see that actually he's pretty close to where we'd imagine that he should be, but obviously as we put supervision level 3, we do then need to make some comments of the things that we think he does well, which we can do, and some of the aspects which we think would look for development. I certainly, when I looking through, I would want to tick that. I think is really good at recognising the people with urgent conditions and that would need to come in from the clinic, and he certainly is very good about completing all the necessary documentation of no aspect.
What have you noticed about the time management?
Well, I mean that's the flip, isn't it? It is that actually, whilst it does recognise all those things, it does take time. I don't know if you've ever been in a clinic with him where we've finished early, and certainly there's always a little bit of wait, not hugely, but enough. So I think that's something that could be something to work on.
I was just thinking about the appropriate investigations and not to investigate, and just sort of weighing that one up in my mind, or not, or whether.
Or is that when recognising when you should be comfortable that it's not vascular and you can say so, we don't need to go on and do further investigations. I've certainly found that on more than on several occasions. It's pretty common, so I'd be comfortable putting that again. Is there anything else particularly? I mean, I know that's taken us up near to the top of the CIPs, but I think that it really incorporates their good aspects and the things to develop.
I think they are, and I think certainly sometimes over investigation just because you don't want to say everything's all right. So that I'm very comfortable with that.
Can I just add one other excellent there, though? I think that actually one in the middle, the managing potentially challenging situations with having the time to talk and diffuse. patients and relatives has been excellent.
Yes.
I found.
Yes, I mean, that to highlight that point about patients and relatives, I think that will be a positive thing, because that comes acknowledging that he does have the skill set to be able to do that. Now, the management of the operating lists is remembering that his operative skill levels don't necessarily have to be as high as him, and certainly SC6. I mean, he may want to be at 3 across the board, but I think it's much more. I find myself in looking over his shoulder most of the time, I would think. So still, I put
really good improvement in skills and confidence, but still want to be there. I'm not happy to be in the coffee room.
Oh yeah, no, but I think it's gone from an A to a B in a short period of time, and it won't be long before. So I would, I'd feed back, but the part of the aspects of that, I think, for me, would be about operatively, if there's something when it's not quite as expected, so manage complications. I mean, it does ask for help, and that's good, but it's that recognizing that that could be a little prompter, I suppose.
It's difficult, isn't it? Because at their stage, are they at an appropriate level for recognizing the complications? But
this isn't. I mean, it's not a negative aspect. It's just something for them to work on development wise. That I think he'll get better quicker if he just concentrate on those some of the non-technical skills and situational, because actually, technically, as we say, we've seen him come along really quickly.
But I think on the positive side, very good on op notes and instructions, really clear.
Oh yes, very good, very good. And that one,
but them all, really good on that aftercare.
Yeah, very good. In relation to, so we've got this one. We've in between. We've talked about that. We've fed back it to all members of the multidisciplinary team.
We have to highlight that, given the thread that we've developed here. I think we probably. I think we should. I'm pleased that we're not using the word inappropriate, because I never see him as really inappropriate, so to speak. I just sometimes think you could have done that differently. I might be, not utilising the scripture as well, but I certainly think that probably encapsulated it. And then the one when we probably highlight most, but I think we've just talked about it most. I mean, I'd see him at 2A here. Hopefully, we've been in agreement. I think under direct supervision, you can certainly guide him. So we're through now. If we save that finish, that looks like that provides a report which I'll obviously print out. I'm due to meet him shortly, and in the next couple of days, and I feel very comfortable feeding that back. I'll be interested to see what his self MCR shows as well, to see if it matches. I suspect
that's very interesting,
but I suspect it will. They won't be far off.
No, he has insight. Okay. So you're going to print and submit.
Yeah, I am going to print that, and I'll submit it.
Okay.
Submitting it will close it there. Yeah. The point I would make for those people doing it on the practice one is that once submitted, it will disappear.